My name is Fen Chen. I'm one of the faculty members here at the School of Pharmacy, and I'm also the co-director for the Advanced Practice in Pharmacy MPharm program. And tonight I'm also joined by my counterpart, Dr. Teja Patel, and our administrative coordinator, Melinda. So we will be able to give you a short, brief overview of the MPharm program after the panelist presentations. So first, we have 4 panelists, and approximately each of them will give approximately about a 10-minute presentation. And the purpose of the presentation is to give you an overview of their experiences, and also to help you kind of start considering your personal journey in terms of what you might want to do after graduation. So we invite you to, participate if you have burning questions. We will have an extensive question and answer period after the presentations, and this will be fairly informal and open to discussion from you all. So I invite you to stay and participate. So I will keep this part short and leave it to our panelists, and I'll let them also give a brief introduction themselves. And so I guess we will turn it over to you, Sam.
Okay, I'm up first. Thank you, Dr. Chang. Good evening, everyone. Thank you for joining us. This is quite exciting. This is my first time joining this panel. So I'm excited to share my experience with all of you. My name is Sam Dubinsky. I am a pharmacist, a PharmD graduate from the University of Waterloo School of Pharmacy program, from the RX 2019 class. I'm also a recent start in the PhD graduate program, the pharmacokinetics program, with Dr. Andrea Edgington and her research team. My research, just as a quick background, is focusing on pharmacokinetic changes in critically ill patients. So we're going to be doing a series of models to try and quantify clearance, get a better understanding of clearance in the critically ill patients on different forms of life support technology, like different modalities of hemodialysis and ECMO. So a little bit about my journey. I graduated from Lakehead University in Thunder Bay. That's originally where I'm from, with undergraduate in biology. And it became quite apparent, I would say closer to 3rd, 4th year, that I wanted to do something within healthcare. I loved the science behind physiology. It was really a pharmacology class that kind of pushed me towards pursuing a career in pharmacy. So I was fortunate enough to apply to the School of Pharmacy at Waterloo and be accepted, where I spent a better part of 4 years there, and really made a home at the University of Waterloo. I would say, to be honest, starting out at the University of Waterloo, pursuing a career in research was not one of my top priorities. I would say my thought of how I thought my pharmacy career would go would be going back to Thunder Bay, maybe opening up a small independent pharmacy, and it's probably the polar opposite of that right now, of where it's taking me. So I would say it became quite evident in 2nd or 3rd year that I wanted to pursue hospital pharmacy, and then have a side with research, a research focus as well. The School of Pharmacy was great to give students an opportunity to try research, to pursue a research field as well. They have the independent study courses, which is a course you can take in 3rd or 4th year that gets you paired up with a faculty member, and you can work through a project for the semester. So I tried that out. Research was something that was foreign to me. I wanted to try something new. I'm a very curious person, so I always thought that maybe that would be a good fit for me, and I fell in love with it. I took a second independent study in 4th year to do another research project, and it was something I quite enjoyed. So like I said, post-graduation after pharmacy school, I wanted to pursue hospital pharmacy. So I applied for a residency program. For those of you who don't know, it's kind of a postgraduate 1-year, 12-month program at various institutions across the country that focuses on hospital pharmacy and clinical hospital pharmacy. And I did my residency at the Ottawa Hospital. So I spent 12 months there. And basically, in a hospital residency, you rotate through the different departments. I would say there's about 10 to 12 different rotations that you do at different clinical areas, and it's really a great exposure to multiple areas of pharmacy, and you get to see a lot of different things. And it really opened my eye to a lot of different experiences and what people are doing with their pharmacy degrees, either within the institution or outside of that as well. So really, it was during my residency that I started to build a passion for building a career as a clinician and as a researcher. So my goal, post graduation, is to have a title as a clinician scientist. To work within an institution, hospital is where I want to be, but is also to lead clinical research as well. I think right now is a quite exciting time for pharmacists within the profession. As you could see, with the past 15 to 20 years, the growth of the profession and some of the different things that pharmacists are doing now and the autonomy that we're gaining within the profession. That's something that is very exciting for me as a new grad, and I want to be a part of that and kind of pushing the boundaries, so to speak. I just came across something yesterday that really resonated with me and is kind of like where I want to end up. I came across a study that was published in the New England Journal of Medicine, and there was an ICU study looking at different modalities of sedation, one versus the other. And it was probably the first time that I really recognized that out of the first 4 authors or so, there was 3 PharmDs within the New England. And that became quite apparent to me that that's something that I didn't see. And I think, we're going to start seeing more of that now within the few years of pharmacists getting involved in clinical research, not only getting involved, but actually leading some, worldwide clinical trials that will have a big impact on clinical medicine. And that's something that I really want to be a part of. So, my interest is in pharmacokinetics, and not only pharmacokinetics, but in intensive care as well. So I had reached out to my supervisor, and there was a project that our team was working on that kind of fits both of those. So it was a perfect fit for me to join the team, come back home to Waterloo, which was a home for me for 4 years. So I'm really excited to get going. I'm really early on. I just kind of started. I started part-time in the fall, and this is my first full-time semester. So I'm looking forward to get going. I'm already learning a lot about different things that pharmacists can do with graduate studies. There's a whole, the more you talk to people and move through your career, the more doors open for you or different avenues are presented to you. So I'm very grateful for that, and super excited to continue with my degree and to see where kind of this road takes me from here. So that's a little bit about me. So I'll pass on to the next panelist. Thank you.
Thank you very much, Sam. It's very interesting that you have gone through the residency experience and then decided to come back to graduate school. And now you will have a bit of that dual experience to compare with. And that could be very interesting for our participants here. So I will now turn it over to Ashley, if you want to take over the podium.
Okay, sure. Thanks, Fang. I actually have a presentation, so I'm just going to share it. I will turn on my video. So can everyone hear me and see me? I'm getting messages. All good. Okay, perfect.
You're good, Ashley.
Okay, so hi, I'm Ashley Sid, and I am a PhD student in the Grindrod and Beasley lab. And I'll go on to the next slide. So a little bit about my education pathway and kind of how I got to where I am right now. So I have been at Waterloo for a long time. So I did all my degrees there. I started in my Bachelor of Science back in 2013 and did 2 years. And I had pre-acceptance into the pharmacy program through the Conditional Admission to Pharmacy CAP program. So I was able to finish my Bachelor of Science earlier than most and start my PharmD. So I did my Doctor of Pharmacy after that at University of Waterloo, actually the same year as Sam did. So we were actually classmates. And after that, I decided to do a PhD, and I'll go into a little bit about how I got into that pathway afterwards. But around the same time, I managed to get licensed, and I'm currently working part-time at the same time I'm doing my PhD. And right now, I'm just starting about my second year in my PhD. So I've been here for a full year doing it. And my supervisors are Kelly Grindrod and Michael Beasley. My focus for my PhD is on online continuing education design, so program design and evaluation. And with that, a focus on harm reduction and optimizing naloxone programs in Canada. So a little bit about the pathway and why I chose graduate school. So in my PharmD, I had the opportunity to do 2 research co-op positions. So I was a research assistant with Dr. Kelly Grindrod during pharmacy school. And I also did an independent 401 study project with her. So doing those co-op terms and the research project really opened up a lot of pathways and interest for research for me. In terms of having done this research and seeing how it's benefited other people in the community, so other pharmacists or other patients, that was really rewarding for me. So that's why I've decided to continue on doing a PhD and further my career goals. The other interesting thing with research and pharmacy together is the whole question of how can pharmacy practice and research actually collaborate. So this is something, the pathway of how this all works out is kind of told in my story. And growing up, I've also kind of had a interest in research because one of my family members is actually a professor at UW. She um, works in geriatrics and is also a dietitian. So if you're ever in those areas of practice, then you would know Dr. Heather Keller. So watching her go through her career pathway and talking about her career as a professor was really always very interesting to me. The second thing, the second reason why I chose to go through graduate school is the other opportunity to teach. So during my co-op program, during my research assistant term, I was able to present at conferences, teach pharmacists about the research I've been doing, present lectures to the pharmacy students about various things I had been researching about. And during my PhD, I'm actually mentoring 2 co-op students right now. So having a team of students to manage is something that I always really liked. The other thing about graduate studies is the opportunity to learn. So during your PhD or whatever advanced program that you choose to do, learning different research techniques that will help you in your future career, gaining lots of skills. I have a whole slide later on about all the skills that you can gain as an independent researcher. And then the lifestyle. So as an academic, the lifestyle is very unique in that you can build your own work schedule. You are essentially your own boss. So that's something that I always enjoyed as an independent researcher, is being able to work from home even outside of the pandemic, and also being able to still work as a pharmacist on the side. So in terms of some of the things that really interested me in research when I was doing my research assistant jobs, is the opportunity to work on the Pharmacy 5 and 5 learning platform that Kelly has. So in terms of program design and evaluation, that's where it really started for me. With Pharmacy 5 and 5, it really involved a lot of literature reviews and creating learning resources, continuing education resources. From these, turning them into modules that pharmacists can complete. So I listed a few of the ones there that I've done. So one of the most popular ones is actually the SERVA module, so the shoulder injury related to vaccine administration. From those, I was also able to write a few manuscripts for publication and present at various conferences. So this was something that I always really enjoyed and wanted to continue doing. So from this, I decided to do my PhD. So this is kind of some of the pictures of things that I've created over the years. So the main page for 5 and 5, the SERVA infographic. SERVA has always been very rewarding, because even a few months ago when I was working at the pharmacy, I had a patient come to me and tell me that she had SERVA and she had seen my infographic online and wanted to talk to me about it. So that was really interesting. And having a patient come to me to talk about SERVA and how she was able to get treatment earlier on because of the research I had done was really rewarding for me. And then the publications on SERVA. Secondly, medical abortion. So with research, it's also really rewarding to work interprofessionally with others. So with medical abortion, I teamed up with the Planned Parenthood equivalent that's in the university district. So they're also called SHORE. So pairing up with them and working interprofessionally with other nurses who can provide expertise on certain things, and working together to create helpful practical infographics and things that can be used later on. And then the opportunity to present at conferences. So taking the infographics and the modules that I created and analyzing the data. So we had chosen to analyze the opioid module that's there. And the reason for that is because it's usually the one that's less performed well on. So we had chosen to investigate why that might happen. And so I was able to actually present that at a conference. And that's another item that's rewarding. And then moving into kind of why I chose to design programs based in harm reduction and naloxone is during my research assistant jobs, I had the opportunity to join public health and offer naloxone at a variety of community events. And I saw how rewarding it was to provide naloxone to people. As one of the events that I've actually given naloxone at is the Ever After Music Festival. So at this festival, normally people are not allowed to bring naloxone kits of their own in. So public health has created a station in this festival where we give them out. And actually last year, or 2 years ago now, there was actually 2 overdoses that were prevented based on the naloxone kits that we had given out during this festival. So that's why I kind of chose that area of research, program design and evaluation, and creating my own naloxone online continuing education program for pharmacists. So in terms of what the PhD has taught me and what I'm learning from it, so in my first year, I took a wide variety of courses, and all of them I'm actually using for my thesis project, so my program design in naloxone. So I've taken and managed to learn a lot about qualitative methods and data analysis. So when you're conducting interviews with your participants and being able to analyze that data. I took a program evaluation course, so learning about the different types of program evaluations that can occur and when you would use which one. Knowledge synthesis, so learning how to do a systematic review and scoping reviews. And from this, I was able to create my own and actually published it. And it was published about 2 weeks ago. Also learning about health economics and pharmacoeconomics. So another portion of my PhD is doing a pharmacoeconomic analysis on naloxone distribution in Ontario. So looking at whether it's cost effective to have it publicly funded. And then the last thing, topics in drug development. That's kind of like the standard that we always learn in pharmacy school is how drugs are developed. In terms of self-taught, so with your PhD, if you really want to learn something, you can learn anything essentially, because you can always self-teach yourself. You have all the resources that are there. So I've managed to teach myself about behavior change theory, using SPSS statistical software, and various online learning program softwares like Articulate and Thinkific. And in terms of the skills that I've developed, so being a graduate student, you learn about project management, so how to manage and design your own project and manage the time in it, as well as all the moving parts. Self-management, so managing yourself and your other work life and your social life, and amongst all your research and schoolwork. And conflict resolution and maintaining flexibility. So originally my research project was designed to be in person. So during COVID, I had to move everything online. Next, student mentorship and leadership. So having co-op students to help you with your research, mentoring them, teaching them about proper protocols, giving feedback to them. And then grant budgeting and grant proposals is something that I'm working on currently. So learning about how to budget your money when you've given a grant or how to apply for a grant proposal. The manuscript publication process and providing peer reviews for other manuscripts. So being able to prepare a manuscript that's suitable for publication, the actual process of submitting the publication itself is its own process. And then when someone is considering publishing something and has submitted it to a journal, actually being able to provide feedback on whether or not that publication is suitable for publication itself in the journal. And another thing that graduate studies or advanced pharmacy practice gives you is advanced research skills and literature review skills. So those skills that you're able to teach yourself a lot of things, anything that you're really inquisitive about, you're able to do that because you've had these advanced research and literature review skills. And then second last, interpersonal and interprofessional collaboration. So I kind of hinted to it that I've collaborated with public health, the Planned Parenthood. I've also collaborated in the past with systems design engineering on a different project, collaborating with other pharmacies, pharmacists across the country in creating my modules for my program. So it's very easy to get involved with others throughout your graduate degree, your advanced practice degree in that way. And last but not least is providing effective feedbacks to students. So during your graduate degree, you have the opportunity to become a teaching assistant. So grading and teaching students in the pharmacy program itself. And I have found it very rewarding to be able to talk to students, provide them feedback, how to improve. All those sets of skills are created as well during this program. In terms of where it's going to take me, my ultimate goal one day would be to be a professor, but that doesn't happen right away as soon as you graduate. So I'm hoping to also continue on in program evaluation. So if you work for a firm or you create your own company, a lot of companies hire program evaluators to evaluate their programs, whether they be in health or not. But in terms of pharmacy practice, there are programs out there for that. And there are also programs available through the government as well. Not necessarily in my pathway, but those with a PhD can also go into the industry, so working for drug companies. And in terms of making an impact, so having my PhD will help me develop and make effective, practical, continuing education programs for pharmacists or any other health professional, as well as optimizing naloxone distribution throughout Canada and turning my thesis into a standardized program. So there is the thought that I might make my program an accredited program for continuing education, so that as well. And lastly, collaborating with others. So the implication is that you can collaborate with public health on other programs. You can collaborate with other health professions, so creating programs for physicians or nurses or other healthcare professionals. And then the reward from all of that is connecting what I see in my practice to my research. So when I'm out working as a pharmacist, I can see all the benefits that the research and the work that I'm doing is benefiting others. And that's it.
Thank you, Ashley. That was it's always nice to actually see examples of your work over the years. And thanks for pointing out that there are some benefits associated with the academic work as well. It's impressive that you're already seeing some of the impact of your work. I find that always delivers some motivation for continuing in that direction. Great. So I think we'll take a slightly different turn, and I'll turn it over to you, Sadaf, to talk about your experiences a little bit.
Thank you, Dr. Feng. Good evening, everyone. I hope you guys are enjoying the session and listening to the people who are in the graduate program right now. So I'll introduce myself. My name is Sadaf Faisal. I am a practicing pharmacist working as a clinical pharmacist at a family health team. And I'm also doing my PhD. I'm in my third year with Dr. Tejal Patel. My thesis project is focused on smart adherence technology used in older adults. I completed an ethnographic study where I went into patients' home and they used smart adherence products, which was a prototype. And we tried to explore the facilitators, barriers, and the impact of the smart adherence technology for their medication intake process. So I'll just explain a little bit how my journey started. So I graduated a long time ago. I'm not going to tell when. It was a long time ago from Pakistan. After graduating, I did my one-year residency in a hospital in different section of the hospitals, like Sam said. I worked at Drug Information Center. I did compounding. I did chemotherapy. I worked as an intensive care intern. After finishing my residency, I worked as an intensive care pharmacist for about a year and a half. And then I got married and I came to Canada. And I obtained my license here in Ontario in 2006, and I started working in the community pharmacy. I worked at various community pharmacies, including independent, including chains. Then I was working at a long-term care pharmacy where actually I realized that my passion is working with older adults. So I found out that my areas of interest was geriatric patient population and specifically their medication management issues. So I obtained my certification from the Board of Specialty Pharmacy as a board certified geriatric pharmacist, which is a standardized program from United States, where you kind of gain expertise related to geriatric patient care. After that, I started working at a family health team. I was trained for the memory clinic. And on one of the memory clinic days, I met Dr. Tejal Patel, and I instantly knew that I really like the work that she is doing in that field. And at that time, I decided if I ever want to do a master's or PhD, I think I have to contact her. She was my first person on my list. And that's what I did. In 2018, I contacted Dr. Patel and I asked her if she is looking for any graduate students, and she was nice enough to offer me her that I can be her student. So I started my graduate studies at University of Waterloo in 2018. This is my third year. The journey has been exceptional. When I came to the graduate school, I came to the school after a very big gap, and I was in the practical field for a very long time, and things were changed a lot at that time. When I went to school, there wasn't a lot of stuff talking about evidence-based practice and all that stuff. So it was like a big learning curve for me when I started my graduate program. To be very honest, my first term was really stressful, but it has been a really great experience. I learned a lot. I, like Ashley said, graduate school provide you so many opportunities. I presented in a lot of conferences. I have presented my posters. I have done podium presentation through the teaching assistant opportunity. I have graded students. I have provided them feedback. I was also involved in teaching a couple of classes related to the geriatric patient care with Dr. Fang. I also did a lot of discussion-based stuff with students in one of their courses. I managed to publish 4 of my manuscript during this time, and 2 days ago, actually, my single author manuscript just got accepted, which I was really excited about. So graduate program, it's been a really great journey for me. You have great mentors at School of Pharmacy who give you a lot of opportunities to learn and, to be very honest, to explore whatever you would like to explore in their area of interest. I did mentor a couple of students while I was working at the family health team, a co-op student from UW, and that was also one of the reasons that I really wanted to come back to UW and do my graduate studies over here, because I really like the program that was happening over here. I think that's pretty much it. Feel free to ask me any questions after the session.
Thank you, Sudha, for sharing that. It's certainly a slightly different pathway to graduate studies. I think it just goes to show you that there is no one set way, and you can build up extensive clinical experience and then return for further training if you so choose. Great. Thank you very much. And as Sudha said, if you have questions, please feel free to put it in the chat box, and we will also have an open question and answer period after the presentations. So last but certainly not least, I'll move on to Joey.
Dr. Fang, thank you. Hi, everyone. So I apologize for being late for this. I had other commitments, so I'm really happy to be here tonight to talk about my experience. So you've had 3 excellent presentations already. So I'm a little bit on kind of the opposite end of Sadaf, where I just recently graduated from the University of Waterloo Pharmacy program in 2020. So I did part of my PBCs, and I'm still waiting to do my OSCE. So I'm not technically a licensed pharmacist yet, but I was accepted to the ambulatory residency at the Center for Family Medicine. So I started that in September of 2020, and I've been there for about 5 months now, where I'll be doing a 1-year residency program. So I guess going back to how this all started, when I first started pharmacy school, I thought pharmacy school was going to be it. and I'm done after that. I'm just going to go into practice. And I didn't even know what a residency was at that time. So my first co-op job was in an independent pharmacy in Preston, so in the Cambridge area, where I was lucky enough to be involved in an INR clinic and a monthly diabetes clinic. So I was able to run that on my own and kind of have supervision. And that was kind of the first time where I felt like I was acting in a proactive role as a pharmacist, as opposed to a very reactive role, maybe in the traditional aspect that we're used to in community practice, which was very interesting to me. And I didn't know that I could be kind of part of the solution. With this pharmacy, I was kind of the first one in my class, I remember, that had access to Clinical Connect. So I think it was my first or second co-op job where this pharmacy was piloting the program, and I got access to lab work. And all of a sudden I was assessing renal function, A1C, when I was doing these med reviews, that I never had that information before. And it was, again, being part of the solution. So I did 2 co-ops there, and I think that was really an intriguing aspect to me, which led into my third co-op job, where I worked at Two Rivers Family Health Team. That was my first opportunity to work in primary care, which at that point was, they always tell you that you're going to know when you're in the right spot, but that was really the first time that I really knew that was what I wanted to do. So I was supposed to be there for 4 months, but I was able to work part-time even during school. So I worked for 10 months at the family health team. And again, I was involved in anticoagulation, so INR clinics. I was doing diabetes reviews. I was in a weekly memory clinic that was very interprofessional. And again, that just made me realize that that's where I wanted to work. And then I heard about the residency program that was affiliated with the University of Waterloo and decided to apply. So contrary to a few people in my class, I actually only applied to the Center for Family Medicine as the residency of my choice, because I knew that I wanted to work in primary care and wanted to work in an environment that was very driven in terms of education and very interdisciplinary. And I was fortunate enough to get the position. So I've been there for, again, like I said, 5 months. And since then, I've been able, so how the residency program works at the Center for Family Medicine is it works kind of in sequential blocks. So I spent the first 8 weeks in anticoagulation clinic and hypertension clinic with Dr. Nagy, Professor Colston, and a few of the pharmacists here. During that time, I was able to get my certification in oral anticoagulation, as well as doing a certificate in teaching through the University of Waterloo. So that was really good, because I've always had an interest in the academic side and getting into education, but didn't really know how to go about it. So that was a really good aspect that I was able to get involved in. After that, I did diabetes clinics, memory clinic that I'm doing right now, med management, cannabis clinics. So a lot of different kind of clinics, again, in interests that were able to be explored. And I think that's the beauty of residency. I've naturally always kind of been drawn to anticoagulation, cardiovascular health in general. So that's how I got into my residency project with Dr. Nagy, where I'm looking at treatment-resistant hypertension in kind of an ambulatory setting through the work he does with his hypertension clinic. I was fortunate enough during school to do an anticoagulation research project looking at loading doses versus maintenance doses following ambulatory procedures, and worked with Dr. Nagy and was able to present at the Thrombosis Hemostasis Summit of North America. It was supposed to be in Chicago, but turned virtual because of COVID, but that was kind of my first real good opportunity to present at a large conference. So an ambulatory residency for me has been a really good opportunity at refining my clinical skills in terms of dealing with very complex patients. But as I was saying, just really being part of the solution, which is what I've always liked. So since then, I've been able to be approached by one of our physicians, actually. So every Thursday morning, I see all of his patients with him, and I'm able to work really collaboratively, which as a pharmacist, I really never thought I'd be able to do. And it it really makes you realize that there's always more to learn, which has been really nice for me as a new grad to be able to expand my knowledge with regards to that. I've also been able to be affiliated to the pharmacy school. So why I was late is because I was doing I'm a TA for a tutorial, what's called IPFC 9, which is one of the classes for the students. So on a weekly basis, I'm the TA for one of the groups. And I've been able to do a few guest lectures for Dr. Feng's geriatric elective and a few other IPFC classes. So I think the greatest benefit for me in ambulatory residency has just been the scope of opportunities I've been able to have and really determine what I want to do. So whether that's spending time in memory clinic and again doing the training with Dr. Lee in that regards, whether that's going into more anticoagulation, I think the advanced learning that I'm having access to just gives you a better understanding of what you really want to do. And I think that's kind of shined through the previous presentations where there's no point pursuing something if you're not going to be passionate about it. And I think the ambulatory residency has been a perfect fit for me in terms of that and collaborating with other researchers, residents, physicians, dietitians. There's just a breadth and range of professionals that I get to interact with on a daily basis. And I'm confident that hopefully that will set me up for a positive future once I'm done at residency in September. But as Sadaf and the other presenters have said, I'm happy to answer any questions about the specifics of the ambulatory residency or any other questions really that may pertain to it.
Okay, it appears that Fen is having some problems with her computer, so I'm going to jump in. Thank you, Joey, for walking us through your journey and for detailing how how you came to do the residency and what you like about the residency. So thank you very much, all four of you. It's a pleasure listening to all of you. Thank you for all your kind comments, Sadaf. I promise I didn't pay her to say all that. But it's lovely to hear how you guys have come to the places that you're at and your journeys. And I know that several people have joined in trying to make decisions, and they value all of the stories that you've brought and talking about the journeys that you've been on to get to where you're at. So I'm just going to look to Melinda right now. Melinda's going to tell me if I present right now or at the end.
Right now.
Thank you. Let me just pull up the presentation and then we can talk about the Masters in Pharmacy. Melinda, do you mind if I do my own presentation instead of that one?
Okay, that's totally fine.
Yes, thank you. I know what I can talk about with this one, so. Okay, hopefully everybody can see my screen. I just need a yes or a no.
Yes.
Perfect. So a brief presentation about our new program called the Master of Pharmacy in Advanced Pharmacy Practice. We call it the Clinical Masters, or the MPharm for short. And this program, the objective of this program is to give opportunities to those pharmacists who are looking to advance their expertise such that they'll become medication experts in the provision of healthcare. They're looking to expand or build on their skills, becoming educators in the classroom as well as in the clinical setting. So being preceptors to undergraduate students, being preceptors to residents, those kind of skills. And lastly, we also want to have this program deliver an objective to build researchers who contribute to the generation and transfer of knowledge that's related to optimal use of medications. And when I say this, I'm thinking about practitioners who work in a variety of healthcare fields, you know, whether they're in family health teams or in hospitals or long-term care, several different types of institutions where they're thinking about whatever I'm doing, or whatever my department's doing, or what the pharmacists are doing, or if we put a new plan into place, how do we measure that what we're doing is producing the outcomes that we want to produce as clinicians? So we're hoping to give these skills to all the pharmacists so that when they are out there practicing, they can draw back on these skills to become the medication experts, to really lead in terms of providing care to patients, to be educators to the next generation of pharmacists, whether it's in the classroom or whether it's in the clinical setting, and also to generate knowledge about what they're doing and how it's changing the healthcare field. So essentially what we've done is we've developed a program that has 3 milestones, as well as certain components related to the practicum, related to coursework, and related to a course research project. So let me just go through the program outline in terms of the milestones first. There are 3 milestones. The first one is the fundamentals of university teaching, and this has 6 core, 2 electives, and 2 semesters worth of programming here. And I know several of our grad students have done fundamentals of university teaching, so I can even have them later talk to how this program helped them develop those teaching skills. We also have an academic integrity workshop, which allows which is something that also needs to be accomplished. And the third milestone that we have is a student leadership program that will be done through the Student Success Office. And I misspoke earlier, the foundational coursework is actually coursework, and I'm going to talk about that next. So here you'll see what we've done is laid out all of the coursework, as well as the practical, as well as the milestones, and how we expect those to be done within the 2 years that the MPharm will be delivered over. So the coursework will be done in the first 2 terms, and will start in the fall of this year. And there are, I will go through the courses separately in terms of what we hope to deliver through them. The second 2 terms will be focused on doing the practicum, but as you can see, we have laid out the practicum, so it is possible to start the practicum earlier. However, what we hope to do is that by the end of the 6th term, students have completed 750 hours of clinical practicums. And we will help our students identify, where they can do the practicums based on their expressed areas of interest. And then finally, we also expect our students to complete a research project. And we want our students to be exposed to the whole process of doing a research project, you know, coming up with the question, identifying a supervisor who can help with the question that's being asked, drawing up a research proposal, making sure you get students get experience doing the ethics application, doing participant recruitment, doing data collection, data analysis. And at the end of that research project, we expect a draft of a manuscript that is good enough for publication, as well as a presentation. And they will also have a research advisory committee to help them with their research project. Now, in terms of courses, we have 2 courses that are dedicated to medication management, and that will go through pharmacology, pharmacodynamics, genomics, kinetics, therapeutics. We've designed these as problem-based learning, very similar to what Joey was mentioning just now about IPFC-9. So it will be a lot of self-directed learning, but they'll have some excellent clinicians coordinating the courses, clinician faculty members. We have one course that's dedicated to methods, so research methods, one that's going to provide extensive skills doing critical appraisal and learning about evidence-based practice. We also have a course dedicated to physical assessment and lab testing and interpreting those labs. We require a biostatistics course be done, and then we have several different electives on offer, and the students can pick the electives that they want based on their areas of interest. We're building our potential locations for our practicum sites so that we can offer a range of experiences to our students. So I'm just going to end that. And that is the end of the presentation on the MPharm program. Fen, are you back? I see you're back. Do you have anything that you'd like to add that maybe I didn't elaborate on, or anything I missed?
No, that was very thorough. Thank you, Tejal.
Okay, I'll let you take over again, and I'm going to sit back.
All right, thank you. So here comes the fun part of the panel discussion. I open the floor and welcome you to submit any questions you may have. You can feel free to either put your hand up or type it into the chat box.
Maybe while people are writing their questions, I could start off the session with a question that I have for all 4 panelists. And I would like to ask, if you were talking to someone who's thinking about future studies, what kind of advice would you give them, given your range of experiences and what you've done and how you've got to where you are? What advice would you give to a pharmacy student who approaches you and says, I'm not sure what I should be doing, whether I should go back to school, whether I should do a residency, whether I should do a master's or a PhD? What advice would you give them? Let's start with Sam. Maybe we can start with you, Sam, and then we'll go to Ashley, Sadaf, and Joey.
Sure. Yeah, that's a great question, Dr. Patel, because honestly, like that was me a couple months ago, really. Like I finished my pharmacy degree. I knew I wanted to work into hospital at that point. I knew residency was for me, so I applied for my residency. Even throughout my residency, I was still kind of like grasping at things as to where I want to take my career. Do I want to work in a hospital full time as a clinical pharmacist? That sounds great, but I wanted to explore different avenues as well. I wanted to build my portfolio per se. So I would say the advice I would give is to don't be afraid to ask questions. Really find a mentor. When Sadaf was talking about you, Dr. Patel, I think that's a really good thing to try and do. Find someone that inspires you, that you can build your career path sort of around or concurrently with. I think that is helpful. There's lots of very interesting pharmacists and clinicians and researchers out there. From my experience, even if you just reach out to them, if it's somebody that you don't know or you see on Twitter and like that their work, if you reach out to them, everyone's very accepting. They would love to share and have a conversation with you about what they're doing. I feel like pharmacists in general are very forthcoming with the kind of the next generation. They want to see the advancement of the profession in the next generation, so they are very excited about kind of promoting that next generation and pushing that next generation forward. So find a mentor, don't be afraid to ask questions, and go with your gut, go with something that you're excited about. You know, my personal experience, pharmacokinetics was my passion. Intensive care medicine, emergency medicine, toxicology medicine was my passion. I wanted to pursue something in that area of pharmacy, in that area of clinical research. So I found a project, found some mentors, both in the hospital and back at Waterloo in graduate studies, that helped me, you know, kind of fit the pieces together. And I think that's probably the most important thing, is to find those people, and don't be afraid to ask around to try and find those people to help mold the puzzle of your life together. And that's definitely what helped me.
Thanks, Sam. That was really good. So you raised a good point about the mentor, and I have to agree with you about that, because if I hadn't had taken that co-op position back in pharmacy school, I would not be where I am today. So having Kelly as my mentor has been completely changing for when I initially thought I would always be in community practice, and now I'm moving into a PhD because of her and her mentorship, and realizing that I had this knack for research and making things practical for pharmacists. Having her as that mentor really helped me move into where I should be, and helping me realize where my strengths are and where my weaknesses are. So if you're able to find a mentor, like Sam said, that is probably your best bet in seeing what opportunities are out there. But if you're wondering whether or not you're ready for advanced training, you should ask yourself whether or not you're feeling fulfilled in the position that you're at right now. So for myself, if I was just in community practice right now and not doing a PhD, I would feel maybe a little bit isolated, a little bit like things are really repetitive. For me, I like to have the diversity of the research on the side, having something a little bit different to do that's making an impact for others. So if you're feeling that things are not diverse enough, you want a little bit of change, you want to explore something, exploring an advanced training might be something that might be the indication that that's where you might want to go. In terms of choosing between the two, that'll be the next question. But in terms of deciding whether or not you're ready, it's to ask yourself the question of whether or not you feel like where you're at right now is monotonous, to be frank.
Really good answer, Ashley. I will second to Ashley on that. So yes, I think that's the first thing that you should always question yourself. Like Ashley said, that is it fulfilling what you're doing? So a lot of the time people do ask pharmacists, you're already a licensed pharmacist, why do you need to go back to school? That was one question that people asked me so many times, that why do you want to go to the school again? You're already, even my daughter asked me, she was like, Mom, why are you going back to school? You're already a pharmacist. So I think that that is very important, especially when you are working in an environment where you feel, sorry, I'm going to turn off my phone, where you're not feeling that you are getting, you are working at your full capacity. I think that's something that drives my thing to pursue the graduate studies, that I have worked in the community, I have worked in the long-term care, I did a hospital residency, I was working in primary care, but still there was something that kind of missing. And that's what I noticed, that in my last 3 years in my graduate school, that I was missing that piece of research where you're actually developing new research, disseminating it, and exploring what you really passionate about. So I agree with Ashley. And I will say the same thing like Sam said, being an international graduate, pharmacy graduate in Canada, I did not have any community feeling when I was working. You don't feel like you belong to some place, to be very honest, and it's very hard to find a mentor at that time. So what I did was exactly like Sam said, that I reached out to people. So try to be as open as you can. If you know someone on Twitter, if you are following someone on Twitter, you feel like they have the same kind of research interest as you, or you even want to find out from them how did they reach at that point where they are right now. People are generally nice. So if you will contact them, if you will just send them a little message and then just ask them, we want to connect with you just to find out if this is something that I want to pursue. People are generally nice. And like Tejal said, she did not pay me to say all those things. But when I emailed her, she emailed me right back. And that's why I'm here today. So just don't hesitate to reach out to people. If you know there is someone in the world of pharmacy who you kind of like, feel like you want to be like that person, just send them an email or try to reach out to them through LinkedIn or through Twitter. They will respond to you.
Yes, I guess to close off, I'll echo exactly everything that everyone said already. I think the mentor thing is definitely a great recommendation. And as a new grad, I was really surprised, to be honest, just in since I've graduated, I always used to be a little intimidated to reach out to people you look up to, but you realize real quick how people are so open and actually do enjoy that mentorship process. So I think it's really a good opportunity to just notice that. One of the things I was always terrified of in pharmacy school was once you graduate, you hear about just becoming so stagnant and not learning anything. And I'd always told myself that that's something I want to avoid at all costs. I think on the flip side of that as well is yes, I agree with you don't want to become stagnant, but there's always that thing that during the day, every time you do it, you're happy to be doing that task. And that was something that I realized with anticoagulation, just cardiovascular health. Every time I get a question regarding something like that, I get excited. I wanted to do that. So I kind of just naturally followed that. And that's how I've been working a lot with Dr. Nagy now in terms of just things that I genuinely enjoy. And I think that was kind of the biggest driver for me. I think, like Sam said, maybe where he was in his first year of residency, I'm still in that period of, yeah, I have a really good idea of what I want to do, but I'm still exploring things. But I think just following what really gets you excited about your job is just a really good way of specializing in that specific area.
Thank you to all the panelists. Those are great answers. I think that's one of the key questions that always comes up, especially as you get closer to graduation. So we do have a question on the chat board. Teresa asks, how does a master's in pharmacy compare with a post-grad PharmD? So Tejo, I don't know if this is a question that you want to address first.
Why don't I can or you can? It's up, either one of us can.
Do you want to go ahead? I'm just
absolutely
fixing something.
Teresa, so as you know, we've moved into an entry-level PharmD across all, if not most, schools in Canada. And in the past, we did have post-bac PharmDs. And a lot of those clinical leadership positions especially in hospitals and institutions, were being filled by post-bac PharmDs. With the move into entry-level PharmD, we still need the additional, knowledge and skills in the components that I mentioned during my presentation: research, education, clinical practice. So the MPharm is essentially our attempt to provide those same skills for the students who are graduating with the entry-level PharmD and are still, want to develop those skills further. So when you ask that question, it's point on. It's really very similar to getting a post-bac PharmD. Our MPharm is going to provide those skills or deliver those skills to the students. Does that answer your question? Feel free to type if I haven't clarified anything. Okay. Fen, did you want to come back in with the next question?
Yes, thank you. And Teresa, I will just add that as Dr. Patel said, it's a very similar model that addresses practice. So there, through that experiential component, I think in my personal view, the MPharm does have a stronger research component as compared to the post-bac PharmD. And that is just in the way the program is set up. There's a stronger emphasis on that part. And that's probably a good thing given the nature of the direction the profession is moving towards. All right. So thank you very much for that question. We have the next question is from Pauline. So she says, does your research project in the Master of Pharmacy program have to relate to the clinical area you choose to specialize in? And thank you all for sharing your journeys, and congratulations on the amazing work you have accomplished. I think that goes to the panelists. So this question about the research project in the Master of Pharmacy, I think what we'd like to do is work with individual students to better understand what your career goals are, so that we can align this experience both in the clinical component as well as in the research component, so that we can align that with your career goals. So for example, if you have a strong interest in infectious diseases, then that would make sense for both to be in that same area. So you can develop clinical expertise at the same time as you develop research skills in that topic area. But I think there would be students who are perhaps still exploring, so they may not know exactly this is the area I want to specialize in. And in that regard, we would definitely have more opportunities. And as you heard from the panelists, graduate studies is a time for exploring. Right? It's a time to find out what you're strong with and what you have passion for. So I think we would also encourage students to do some of that exploring with these training opportunities. Hopefully that answers your question. Teja, feel free to add if you want to.
No, I think you've answered the questions. I see some participants asking me also typing, so I think they're asking the questions. You can also raise your hand if you want to type just the questions by coming on. We can, if you raise your hand, we'll call on you so that you can ask your question as well. And so while the other participants are, oh, there's another question. I'll let you take it, Teresa, Fen.
Yes, from Teresa, she says, is there an opportunity to further develop informatics or medication safety skills in the program? Great question. I think these are areas that that we'd like to definitely add in. What specific are you thinking about? Like something formal, like in like a course, or are you thinking about rotation opportunities or research areas? I think in terms of research and rotation opportunities, it's definitely something that we'd like to incorporate. And this goes to that whole development phase, right? We'd love to work with you to figure out what would be helpful to advance your career in terms of useful skills like that. And that's what we're in the phase of doing, identifying suitable sites and suitable people that you can work with. Yeah, in terms of courses, Melinda, do you know, or Tejal, do you know if we have something that's specifically focused on informatics and medication safety?
One of my team members is currently completing her master's in health informatics at the University of Waterloo. So I'm aware of programs, dedicated to health informatics. We haven't looked at specific courses, but we could definitely look to see if our students would be enabled to take those courses if there is an interest in informatics. We also are on campus with the best engineering school in the world. So I'm sure there's potential for collaborating on informatics and if there's interest in that area with other faculties at the school.
Yes, I think as Tejal mentioned earlier, there are opportunities to do elective courses in the MPharm program. And if this is an area of interest for you, then coursework as an elective could definitely work. Yeah, that's right. We do have we have a great program on main campus, actually, that they run their own graduate program in medical or health informatics, I think it's called.
Yeah.
Great. So next we have Adam, who is asking, thanking you for an informative webinar and asking how the experiences gained through the practicum compares to that acquired through a pharmacy residency. It's a great question. Our panelists who have gone through the residency experience, do you want to comment first a little bit about what you think you acquire through the pharmacy residency program, and then perhaps we can comment on the practicum component for the MPharm program.
Sure, Dr. Fang, I could start. Yeah, so as I mentioned, I just recently completed my hospital residency program. It's 12 months and change of a program, and you rotate through, I would say, about 10 to 12 different areas of the hospital, mostly of your choice. If the hospital provides that service or has that floor, basically you can do a rotation there. So you have your medicine rotation, infectious disease, cardiology, you could do surgery, ICU. The program I was at had a toxicology component, which was an on-call toxicology to help. You were actually leading the service. Us pharmacy residents were leading the service for the hospital to help the emergency medicine team with any poisonings, drug overdoses, any medication safety issues in the hospital. So you're working with someone, you have your independence as well, but you're working under your preceptor or the senior pharmacist to that floor or to that clinical service. And you're really, taking on a patient load of, maybe 3 to 5 patients at a time, working them up. You're the sole pharmacist for those patients. You're responsible for those patients. But you do have someone as a backup per se to bounce ideas off of, to learn the ins and outs of the clinical service and to apply what you've learned in school and take it one step further and to really, be, I would say, an expert in the 4 to 6 weeks that you have on that service. But it's really the intensive training within that service to give you the skills to be an expert. So that's, you learn a lot of different skills of what it takes to work with a patient, managing a roster, a full patient roster, very, some practical skills along with some critical thinking skills as well. Also, I think one thing that that may be similar between the two that I found, like I didn't do the practicum, obviously I did the pharmacy residency, but I think one thing that will probably be similar between the two is really gaining that clinical confidence. That was one of the biggest things that I took away from residency, is confidence in myself, confidence in my clinical ability, and confidence in what I can do to an interprofessional team, what I can bring forth to an interprofessional team. And I think, the practicum would help build that confidence for you as well.
Thank you, Sam. I think you said it very well. I would just basically echo what you just said, and I think the experiences will be quite similar. There might be some differences in terms of where the student starts out. A lot of I would say predominantly the residents are still new graduates. So the level of competency is basically aimed at that level. Whereas for this MPharm program, we actually have a number of applicants who have extensive experience in a particular area, so work experience, for example, and that could change some of the leveling in terms of competencies that we're looking at. So I would say that might be a difference that you could feel, but overall, in terms of the goals of the practicum as compared to pharmacy residency, I think there are a lot of similarities.
If I may just add to that, when you're pursuing a residency, you get exposed to lots of different areas of practice and specialties of practice, so you can gain expertise in those areas. Dr. Chang just mentioned that many of our applicants have quite a bit of experience, and if they express an interest in one or two particular areas, we might build their practicum experience to give more exposure to those areas. So, for example, if they express an interest in geriatrics, we might help them build more experience and expertise in geriatrics by placing them in one or two or three different locations with three different focuses in geriatrics, so that they could build that experience. That would be the other difference in terms of the experience that you gain with the practicum versus a residency. Hopefully that answers your question, Adam, but I see that you're typing. So while Adam is typing, Fen, do you have a question to ask the panelists, or?
Sure. Yeah, I always have questions. I'd love to hear. So one thing that people get concerned about is they have just gone through lots of years of school and intensive school at times. What do you have advice for people who are considering to enter further training and education, formal or otherwise? But do you have advice on how you have managed to work this whole school, work, career, family balance when it comes to choosing to further your education?
Maybe we can start with you, Sadaf.
Sure. So it's a bit of a struggle at the start. Like I mentioned earlier, that in my first term, it was a little bit stressful. I have two daughters. So I have to drop them off, pick them up, pack their lunches. Plus, I had to come to the university. For the first term, I came to university 5 days a week. And I used to be there at 9 o'clock, and I used to stay there till 4, 3:30, depending on what the schedule was. And then sometime I had a class in the evening for the courses that I was taking, so I would just stay in the university till 9 o'clock. my husband also have a community pharmacy and a small independent pharmacy, so I was helping him out at that time. Luckily, I was not working at the family health team. I had a leave of absence, so I didn't have to worry about that. Plus, I'm in that sandwich generation where you have older parents that you have to take care of, take them to the doctor's appointment, do all that stuff. So it was a bit hard, but at the same time, what I learned in graduate school is time management. So I won't say that it would be very easy for you to do, juggling between the family life, juggling between the work life, and also the school life. But I think you do learn at the same time a great deal of time management skills during the program, and that helps you a lot. Also, I think people who are already in the workforce for a few years, they have already learned the time management because they are dealing with the work life and with the family life. So I would say it would be a little bit easier to incorporate the school life back in that whole equation. But I think take it slow. Like, don't beat yourself up. You don't want to just do everything. So if you will take it slow, I think it will be easy to manage.
I can jump in next here. I think for me, the biggest thing has always been doing it with a purpose. So I've had conversations with colleagues of mine as to just doing something for whatever your motive is, right? If it's just for the credentials, personally, I don't always think that's the best way to go, because I don't think that's a strong enough motivator to get you through the long hours and everything. So like I said before, like I only applied to one residency because in my head it was like, I want to do this residency and gain the skills specific from there. And I knew that the long nights, and I remember thinking, oh, pharmacy school was so easy compared to residency expectations sometimes for me. But again, it's kind of like I'm very passionate about it. And I think that's the reason why I enjoy it, and I get to work with incredible people and just learn from them and still be independent. So for me, it was just always, if I'm not really passionate about it, there's not really a point in doing it, because again, my residency is just a year, but if you're looking at a master's program, which is 2 years, it's longer, right? And you want to make sure that you don't get lost during that time and kind of lose focus on what is actually the purpose of it. But if it's something that you really believe in and you think will help you in the long run, I think that's kind of the driving force that'll really help you in terms of setting whatever career path you're choosing for yourself.
I'll jump in next. So I would say that it's time management mostly is the main skill. And as pharmacists, we're already experts in time management, because when you're working in a pharmacy, wherever it is, you have to manage a million things all at once. So using that skill, you already have it. That's the main skill that there is. In terms of balancing it all, I would say the main thing I learned transitioning to a PhD during the pandemic is making sure that you set yourself a schedule. Setting a schedule for the hours that you actually spend working, studying, whatever the two, and then having the set hours in the evening or whatever it is for you to do home, family life, and whatnot. I would say that during the PhD itself, from my perspective, the first semester or the first 2 semesters are probably the busiest, because that's when you tend to do your coursework, and that's what makes the PhD the busiest. But once you get past the coursework, doing managing your own project and your own research is fairly straightforward from there, because you're your own boss, kind of like what I was saying before. And if your work, like if you plan to work as a pharmacist while you're doing your advanced training, if you happen to have a workplace that's flexible, you can always work out your schedule with your advanced training. And that's currently what I've been doing, where I say the days that I cannot work, and those are the days that I spend on doing student and research. It's what you make of it. Like having those time management skills and knowing what you want to do and what you accomplish, kind of like what Joey said, is kind of what drives you through.
Yeah, I'll just finish off quickly. I don't have a family or kids, so Sadaf is the MVP of the group, the most valuable panelist here. She's got more than me, for sure. But I would say, you know, when I finished pharmacy school and then I started into residency, people looked at me like I had two heads. Okay. And then I finished my residency and I wanted to pursue graduate studies, and they looked at me like I had three heads. I think you need to, you know, internalize your thoughts that we talked about before. Go with your gut. If this is something that you really want to do, this will become something that you're passionate about, and it will make it easy for you. I think, you know, it's a marathon, not a sprint. So you need to really think about that. You know, I just rolled out of a residency into graduate studies. So I'm really trying to manage my time accordingly right now and look at the bigger picture of what I want to accomplish, and not trying to overwhelm myself in the first couple of months, because, you know, you're working on a potentially something that could take 3, 4, 5+ years. So you need to really stretch that out over that time and not try to complete it in a series of 1 year and drive yourself to the ground. But I think, you know, you guys signed into this presentation because it's something that you're interested in. It's something that you are probably passionate about, pursuing graduate studies or pursuing advancement in the pharmacy profession. So I think that will make it easier for you. It will be something that you will enjoy, something that you will love, and it won't feel like work per se. It will be something that you're happy about. You know, I could say that I'm quite content with where I'm at right now, doing my graduate work. I'm working part-time in a hospital. It's exactly where I thought where I want to take my career. So I'm grateful for that. So I think, you know, pursuing these programs like this will help you find your passion.
Well, thanks, everyone. There's a question from Adam that says, so for pharmacists seeking to transition from community to hospital, is the MPharm a good place to start, or is hospital experience sort of a prerequisite? So I guess the short answer to that is the hospital experience is not a prerequisite, but actually the transition point, I think, is a good one. And I wonder if our panelists, if any of you have comments on for advice for pharmacists seeking to transition from the community to the hospital. In your experience, have you dealt with that? Have you seen that in your peers, or what kind of skills or experience would be helpful to make that transition successfully?
I can start on that. So I did my transition. I was working as a community pharmacist, and then I did my transition from community to long-term care. At that time, I was pursuing my certification as a geriatric pharmacist. So that was not something that is exactly the MPharm program is, but because having that certification and going through that experience actually helped me gain a position at a long-term care pharmacy, and then further into the primary care in the family health team. So that did help a lot, because then I had, when we are working in the community pharmacy, unfortunately, we don't have a lot of clinical access. Like, we are not able to use a clinical connect, or we are not able to see patients' medical records. So we are not, like, we do what we can do our best as a community pharmacist in Canada, but we can't do too much clinical work in terms of really going through patients' medical records, or like, you know, identifying what really need to be done. I think that's something that we need, and those clinical skills you really need in order to work in a hospital setting or in a primary care setting where you are working very closely with the physicians and with the other healthcare providers. So my experience transitioning from the community pharmacy into primary care and long-term care, I think that clinical knowledge and expertise that I gained through my certification as a geriatric pharmacist helped me settling over there in a very different way. And I think that MPharm program can be a really good place to start, because now you're going to learn all those skills that you can actually apply in a very clinical setting in a hospital or in a primary care setting.
I could add just a few more things, just because I'm relatively new into this process. I kind of just went through this experience from transitioning into a resident, into looking for jobs, and gaining a role as a hospital pharmacist. So when you look at the institutions, maybe some of the larger academic institutions versus a community-based hospital, they'll definitely look at prior hospital experience as preferred. Residency is something that is preferred for some of the larger academic centers. It's not a prerequisite per se. It's not a mandatory credential per se. I think it may be an unofficial one that most people would look for. And it's really just because of the extent of training that you gain from a residency. And I think most institutions and most employers will realize that the training that someone with a residency endures. So, I think a lot of the same training will be mirrored with the MPharm program. It's now just, I think there'll be some need from graduates of the MPharm program, need from the institutions that are offering these MPharm program, maybe from the colleges itself to kind of advocate and educate what the MPharm program actually entails, to make sure that the institutions are keeping up, and to recognizing what these credentials and what these training programs are actually involved. Because I think that's maybe where sometimes the disconnect between residency looking for jobs and not having residency. There's no real standard, so to speak. It's all kind of institution specific. So I think at the end of the day, the training is what people are looking for. The extensive training, showing those clinical skills, showing those critical thinking skills, is something that will help you transition as a hospital pharmacist.
Okay, thank you all. I worked as a hospital pharmacist for many years before landing here, but in my career, I've certainly seen pharmacists trying to make that transition, and they were successful. But I have to say, I had a colleague who worked for many years in the community and worked with community practice on long-term care homes, and when she moved into hospital practice, she had a really hard time, and it wasn't because of a lack of education or any sort of. It's just lack of exposure. I really think that's what it is. She was really uncomfortable with things like IV antibiotics because that wasn't something she dealt with for years and years on end. So I think in the cases, they actually have a lot of the skill set foundation already there, and a pretty strong one actually. But it's almost like you're missing a few pieces to settle into this new environment. And that would happen for anybody transitioning from, I think, any setting to a quite a different setting. And I think that the MPharm offers that opportunity to almost like get those get what you need, those pieces, get that opportunity to get that exposure to those pieces all over again in a relatively short period of time as compared to an undergraduate program. So that is one thing that could offer. All right, I'm not seeing any more questions on the board at this time.
Since maybe I can ask a question.
Please
Since
go ahead.
we've been talking about the MPharm program and you know what is possible and what is not possible, I'm going to ask our panelists if we had the MPharm program, if it had been in existence when you were all doing your undergraduate studies, would you have looked upon it as a potential for something you would have been interested in? And are there components that would have you know, of the program that would have been of particular interest to you guys? Joey, shall we start with you this time?
Yeah, for sure. I'm happy to answer that. I think I would definitely have looked into this, and I think the main reason is probably the research focus that is with the MPharm. Research was and still is kind of something that intimidates me a little bit, and I think in undergrad you get exposed to it and you get to do a 401 if you're interested in doing that, which I did because I wanted to kind of push myself in that direction. But again, it's just kind of at the end of the day fairly, I don't want to use the word superficial, but you don't get that extensive knowledge base in research that you would with the MPharm. And I think for me that would be the biggest attraction in gaining those skills in terms of being able to go through an actual project, doing data collection, all of that. So that would have definitely been something that would have interested me because I have an interest in that area. So that would have been the main driver for me. And again, it goes back to what my career aspirations are, where I'd like to gain those skills. So I think for that reason, I would definitely have considered the MPharm going out of the PharmD.
Thank you, Joey. Would any of the others like to add anything? If it had been an option, would you have considered it? Ashley, you're muted. Thank you.
I forgot. Yeah, I can jump in. So back when I was graduating, I had heard through the grapevine about this program, and I initially was very interested and wanted to go about it, but at the same time, I heard about when it was going to be launched, and I thought it was too far away from when I was graduating. And I had this fear that if I graduated and started working, I would get into this monotonous routine of just pharmacy practice life and not be able to return back to school. And so I thought, well, I really like research, so I'll just go through with a PhD instead of the MPharm. But if it had been available by the time I had graduated, I probably would have gone for that.
So I'll just add it to a little bit too. So I actually entered in the master's program, and at that time there was no MPharm program that was being offered. And I think if the MPharm program, and I transitioned into PhD after my first year, but I think if the MPharm program would be there, I would have really considered it. Especially, I really like the component of research, like Joey said. That is something that I always feel that I need to learn. I did not have any training in my undergrad program related to research, so that was something that is really intimidating for me, even up till now. And also the combination of the practicum. So when you actually have, and especially if you are trying to gain skills that you can transfer into the clinical practice setting, I think the component of practicum with the research, I think that's a really great combination, which I do feel that in the master's only program, that's the piece that is missing, because this piece actually gives you what the real world experience is, which I think at the end of the day, we all want to go and work and do our clinical practice. So I think that's really the great portion of this program.
Thanks, Siddharth.
Yeah. Oh, I'll just finish up quick. Yeah, that was, I think I definitely would have considered it. Where I was at that point, graduation, looking at residency, it was looking for advancement, building a career with different unique skills that maybe I didn't, pharmacy school didn't offer, or more practical experience that, I didn't get through pharmacy school. So I think that would, the MPharm would have that as well. At the time, research was something I liked. It wasn't something that maybe I thought I would, build a career upon or pursue a career upon. I think I, grew into that more into my residency. So they would have been definitely something I would have considered, since it is heavier focused on the research aspect. For those of you who don't know, hospital residency as part of the accreditation standard does require you to complete a research project. However, I think it's a little bit different because a lot of the projects are kind of already planned out for you per se. It seems like the MPharm, you're really going from the ground up, building the project yourself. It seems like with help from some of the preceptors and faculty. So that may be a deciding factor. I think the work experience hours wise looks about the same. The MPharm is stretched over 2 years versus 1, with a little bit more focus on the research. So I think if you're looking for further advancement in your career, an extra tool in your toolbox, the MPharm would have been something I would have considered at that point.
Thank you. Thank you for answering that question, everybody. Ben, back to you.
All right. That was great discussion, everyone. I don't see any more questions on the board. So and are there any questions from anyone else?
Ben, I'll ask you a question.
Oh, okay.
Talked about meandering journey before you became, a professor at the school. So the question I'll ask you and all the panelists is, do you ever feel like you wasted time doing the things that you did before you got to where you are?
Oh, great question. Sure, Tejal, put me on the spot. See, we haven't rehearsed this one. No, I think the short answer is no. I actually really enjoyed everything I did before, although this is a bit of an unexpected landing spot, I have to say, was not part of my initial career plan at all. I have to say, I think everything I've done previous to coming here, actually, everything has been really helpful to what I'm doing today. So that's my short answer.
Any of our panelists feel like, given Sadaf has got a varied experience, Sam, you did residency and then came on to a PhD. Do either of you feel like what you've done so far has been a waste, or has it only added to a feeling of accomplishment and, felt like, oh, that was meant to be?
So I can start. So I think, no, I definitely don't feel that I wasted any of my time. I think I did feel a little bit, I will be honest, before I started my PhD, because I didn't know, I was kind of a lost at that time. I wasn't having that, yes, this is what I want to do. But no, definitely. I think what I did through my career, working in different settings, working in community, working in the primary care, even obtaining my board certification for geriatric pharmacist, I think it all helped me to be where I am today. Especially, I feel like I feel a little bit confident because I kind of know that I just don't know what's happening in the research world. I also know what's actually happening in the real world setting where things are actually getting applicable on the patients and how we are providing the care. So I kind of feel like that is very useful for me. Even when I was planning for my thesis project, that part of my life that I have gained experience working with patients helped me a lot. When I went into my patient's home, actually I connected with them very instantly because I had that connection as being a pharmacist. So that helped me a lot in gaining their trust, in having those conversations that's usually kind of like, if you go there just as a researcher, not as a pharmacist, you may not pick those things that I was end up picking during those conversations with my patients. So I think that has helped me a lot. Also related to the geriatric patient population, because I know I won't say I know everything, but I am aware of what problems our geriatric patients are experiencing with their medication management. And that kind of drives my passion to pursue this research, and also to kind of like think about the projects, how we can make their life better in terms of their medication management. So it helped me to be where I am today.
Yeah, no, I definitely don't feel like there's any waste of time or regret anything that I've done thus far, even though there were days and there may be days ahead where I feel like I will regret it. But overall, definitely do not regret any of the experiences I've had so far. My residency year was just such a year of exponential growth, both professionally and personally, where I gained so much from that year. And it really kind of pushed me into where I want to go, open my eyes to a lot of different things, different clinicians. I made a lot of good relationships, connections there. So it was definitely a worthwhile year as growth and learning. So it's only helped, and I really want to have both worlds kind of come together. That's my plan for myself, and I think having the residency and now my graduate studies will they will both mesh nicely together at the end, I hope.
Perfect. Ashley or Joey, do you guys want to add anything to what Sadaf and Sam have mentioned?
I say no, I don't regret anything. There are certainly times where you feel like you might, but definitely know once you accomplish something like publishing a paper or getting a good grade on a test in pharmacy school or passing your licensing exams, you feel like this is why I was going through this sort of thing. And going through all those things, they can be difficult, but there is the reward in the end. And I feel like no time has been wasted, because each thing has literally built, in my pathway at least, has literally built blocks upon each other to where I am now.
Thanks.
Yeah, I can't really add that much because I'm fresh out of school at this point. But my biggest fear was like always, it's a bit funny to say, but like the whole like residency, you're not going to make money while all your other colleagues are going to be making like a full salary. So that was always kind of the fear. Oh, am I doing this? Is it actually going to lead to something? And I still have like those moments where I consider, oh, is it actually going to lead to something? But there's no way to actually know that, right, at the end of the day. And I think there's just, like Sam kind of said, like that exponential growth that I think I'm kind of going into right now, and building those soft skills that you never even realize you're picking up along the way. And then all of a sudden you do something and you're like, oh, wow, okay, I didn't realize I could actually do that. So that's been a really good area for me, but I think it's a little too soon for me to provide a good answer to that question.
I think the key here is that it doesn't matter what you do when you start on this journey. What you do when you're starting, or what you do is you acquire skills, no matter which pathway you pick, in terms of, whether it's a clinical master's or an MPharm, or a master's in science or a PhD, or doing a residency. What you're doing is acquiring those skills that are always, or more often than not, will come in useful as you progress through your career and your journey. I think that's the key. So thank you, panelists. Those were really brilliant answers. I'll stop there. I won't ask any more questions, and I'll hand it back to Finn.
Thank you. So I think we're coming close to our time, our scheduled time. So if there are no further questions, I will begin to wrap up. So I think tonight, just waiting for a moment to see if there's a new question coming through here. So I think tonight we heard from our pharmacist grad students and residents, and heard what really you all talked about, what motivated you to seek out these postgraduate opportunities to further your skills, and how these experiences or skills are helping you to perhaps open new doors or learn more about your capabilities, and perhaps help you to build towards your career goals. Hopefully, these have offered helpful insights for those of you who were in the audience and listening on, and something for you to think about. And when it comes to making, obviously, these are really important decisions we're talking about. So hopefully these will be helpful when it comes time for you to think about these career decisions. If you are interested in exploring further, we would welcome you to join us for our future webinars. So you can watch for announcements from the school or contact Melinda to be added to our email list. You can also find lots of great resources on our website. If you go to the school's website, look under Graduate Studies, there is a tab for MPharm, for Advanced Pharmacy Practice. So the website will list all the information we talked about today and more, so including things like application information and timelines and specific courses, etc. And I will also post the website address in the chat box in a second. So feel free to reach out to Melinda, Dr. Patel, or myself if you have any questions or would like more information. And as we're bringing this webinar on advanced training in pharmacy to a close, I'd like to thank our panelists, Sam, Ashley, Sadaf, and Joey. You've all shared your personal journeys and unique experiences and perspectives with us today. Melinda, for organizing this event and making it possible for all of us to be here. And Dr. Patel, for your kind support both before and during this event, especially when my computer had a bit of a meltdown. And most of all, I'd like to thank our participants, all of you here, for sharing your precious evening time with us. So I hope you all have a great rest of your evening, and thank you for joining us tonight.
I just want to take a moment and echo Dr. Chang's comments. I want to thank our panelists. You contributed some really great discussion points, and you're helping our participants make decisions about what they want to do and how they want to pursue graduate studies. I especially want to thank Melinda for helping us with this program. She does a lot of work in the back, as does Sadaf, because she helps us with this program as well. So I want to take a moment and thank both of them. And thank you, all the participants, for joining us. Thank you, Ben.
Thank you all. Have a great night.
Bye, everyone.
Bye. Thank you again, everyone.
Thanks, guys. Nice to see you all. Bye-bye.
Thank you.